I'm Dr. Bob Bernstein. I've been a practicing physician in Seattle now for 23 years. I grew up on the East Coast outside of Washington, D.C. I went to school in Virginia and then medical school in North Carolina. And after a few years of ending up in the Deep South, I made a sharp turn out to the West Coast in Seattle and came out here and did my family medicine training. I've worked in a variety of clinics in Seattle in regular family practice clinics. I also did 2 years with public health degree at the University of Washington, the family medicine department there, and stayed involved in teaching medical students there as well. And now I've been with Carena for over 6 years. It wasn't something I always thought about when I was real young, and once I got into college I actually started out as and was an economics major, but I also liked a lot of the sciences. I liked biology and I liked chemistry. I liked a lot of social issues well. So about halfway through college was looking for something that kind of tied a lot of those different issues together, and kind of found medicine as a good option. I wasn't kind of the typical pre-med route from day one of college, but kind of found my way into medicine that way. And then I think that's also through my medical education and career choices, that's also, I think, influenced me a lot in, focusing more on primary care and community-oriented medicine. One of the great things about being in a regular traditional practice is the continuity that you have with patients, and you got to develop those relationships over time, work through them. What was, I think, most frustrating was the pressure to do more in less time, and the fact that, healthcare as it is today, this requires you to be very conscious of the time that you spend with patients, and there's a lot of pressure to do more fast. So that's when I found Carena, and it was a really good match because they were doing it on a bigger scale, but at the same time really kind of thinking in innovative ways and looking at how you could deliver medicine in more effective and novel ways. And as part of that, I think what I really liked was a lot of that emphasis was on kind of, again, the quality of the care and not the quantity. And so as they looked at, evolving from house calls and work site visits to telemedicine, that emphasis has always been on kind of doing the best assessment, best care that you can for that patient in front of you, and that's going to lead to the best outcomes, as opposed to seeing them as many patients as you can.